Introduction to speech therapy. Speech therapy, also known as speech-language pathology, is a specialized healthcare profession focused on the prevention, diagnosis, and treatment of communication and swallowing disorders. These disorders can affect individuals of all ages, from infants to the elderly, impacting their ability to speak, understand, read, write, and eat safely. The field is dynamic, integrating scientific knowledge with clinical practice to improve quality of life. Speech-language pathologists, SLPs, work in diverse settings including hospitals, schools, private clinics, and rehabilitation centers. Their primary goal is to help individuals achieve their maximum communication potential and ensure safe oral feeding. This introductory section will provide an overview of the profession and its critical role in healthcare. The scope of speech therapy encompasses a wide range of conditions, addressing both developmental and acquired disorders. This includes difficulties with articulation, voice, fluency, language comprehension and expression, cognitive communication, and swallowing. SLPs employ various assessment tools and therapeutic techniques tailored to each client's unique needs. Understanding the breadth of these areas is fundamental to appreciating the impact of speech therapy. The profession continuously evolves, incorporating new research and technological advancements to enhance patient outcomes. Scope of speech therapy practice. The scope of practice for speech-language pathologists is extensive, covering a broad spectrum of communication and swallowing functions. SLPs assess, diagnose, and treat individuals with speech-sound disorders, including articulation and phonological impairments. They also address language disorders, which can manifest as difficulties in understanding or expressing spoken and written language. Voice disorders, characterized by abnormalities in pitch, loudness, or quality, fall within their expertise. Furthermore, fluency disorders, such as stuttering, are a significant area of intervention. Cognitive communication disorders, often resulting from brain injury, also require SLP intervention. Finally, dysphagia, or swallowing difficulties, is a critical area where SLPs play a vital role in ensuring patient safety and nutrition. Anatomy of speech and swallowing. Understanding the intricate anatomy involved in speech and swallowing is fundamental for speech therapists. The respiratory system, comprising the lungs, diaphragm, and trachea, provides the airflow necessary for vocalization. The phonatory system, centered around the larynx and vocal folds, produces the sound source. The articulatory system, involving the tongue, lips, teeth, jaw, and palate, shapes these sounds into recognizable speech. Additionally, the resonatory system, including the pharynx, oral cavity, and nasal cavity, modifies the sound quality. These systems work in highly coordinated fashion to produce intelligible speech. Any impairment in these structures can lead to communication difficulties. A thorough knowledge of these anatomical components is essential for accurate diagnosis and effective treatment planning in speech therapy. Physiology of speech and swallowing. The physiology of speech involves the dynamic interplay of multiple systems to produce complex vocalizations. Respiration provides the power source, with controlled exhalation driving air through the vocal folds. Phonation occurs as the vocal folds vibrate rapidly, creating a buzzing sound. This sound is then resonated and amplified within the pharyngeal, oral, and nasal cavities. Articulation further refines the sound into distinct phonemes through precise movements of the articulators. Swallowing, or deglutition, is an equally complex process, divided into oral, pharyngeal, and esophageal phases. It involves a coordinated sequence of muscle contractions to safely transport food and liquid from the mouth to the stomach. Understanding these physiological processes is crucial for identifying the underlying causes of communication and swallowing disorders. Child language development stages. Child language development follows a predictable sequence, though individual variations exist. From birth, infants begin to develop pre-linguistic skills such as cooing, babbling, and joint attention. Around 12 months, the first words typically emerge, marking the beginning of the one-word stage. By 18 to 24 months, children start combining two words, rapidly expanding their vocabulary and grammatical structures. Preschool years, 2 to 5 years, are characterized by an explosion in language complexity, with children mastering more complex sentences and narrative skills. School-age children continue to refine their language abilities, developing advanced vocabulary, pragmatic skills, and literacy. Recognizing these developmental milestones is essential for identifying potential delays or disorders. Early intervention is critical for supporting children who exhibit language difficulties. Adult language disorders, aphasia. Aphasia is an acquired language disorder resulting from damage to the brain, typically in the left hemisphere, often caused by stroke, traumatic brain injury, or progressive neurological diseases. It affects an individual's ability to comprehend or express language, impacting speaking, listening, reading, and writing. The severity and specific symptoms vary widely depending on the location and extent of brain damage. Common types include Broca's aphasia, characterized by non-fluent speech and good comprehension, and Wernicke's aphasia, involving fluent but often meaningless speech with poor comprehension. Global aphasia represents severe impairment across all language modalities. Speech therapy plays a crucial role in assessing the specific language deficits and developing individualized intervention plans to improve communication. Rehabilitation focuses on restoring language function, compensating for lost abilities, and teaching alternative communication strategies. Family education and support are also vital components of aphasia management. Speech sound disorders, articulation and phonology. Speech sound disorders encompass difficulties in perceiving, motorically producing, or phonologically representing speech sounds. Articulation disorders involve problems with the physical production of specific speech sounds, often characterized by distortions, substitutions, omissions, or additions. For example, a child might say wabbit instead of rabbit. Phonological disorders, on the other hand, relate to patterns of sound errors that simplify speech, affecting entire classes of sounds. This might include fronting, replacing back sounds with front sounds, like tat for cat, or stopping, replacing fricatives with stops, like pun for fun. These disorders can impact speech intelligibility, leading to communication breakdowns and potential social or academic challenges. Speech-language pathologists conduct comprehensive assessments to differentiate between articulation and phonological errors, guiding targeted intervention strategies. Early identification and intervention are key to improving speech clarity and overall communication effectiveness. Fluency disorders. Stuttering. Fluency disorders, most commonly stuttering, involve disruptions in the rhythm, rate, and flow of speech. Stuttering is characterized by repetitions of sounds, syllables, or words, prolongations of sounds, and blocks where speech is momentarily halted. These core behaviors are often accompanied by secondary behaviors, such as eye blinks, head jerks, or avoidance strategies, which develop in response to the stuttering. The onset of stuttering typically occurs in childhood, though it can persist into adulthood. The exact cause is complex and multifactorial, involving genetic, neurological, and environmental factors. Stuttering can significantly impact an individual's communication effectiveness, self-esteem, and social interactions. Speech therapy for stuttering focuses on helping individuals manage disfluencies, reduce secondary behaviors, and develop positive communication attitudes. Techniques often include fluency shaping, stuttering modification, and counseling to address emotional aspects. Early intervention is crucial for children to prevent the development of chronic stuttering patterns. Voice disorders occur when there is an abnormality in vocal quality, pitch, loudness, or vocal effort that interferes with communication or reduces quality of life. These disorders can stem from various causes, including vocal misuse or abuse, example, yelling, excessive throat clearing, organic conditions, example, vocal nodules, polyps, paralysis, or neurological diseases, example, Parkinson's disease. Symptoms may include hoarseness, breathiness, vocal fatigue, pain or discomfort when speaking, or complete loss of voice, aphonia. Speech-language pathologists play a vital role in the assessment and treatment of voice disorders, often collaborating with otolaryngologists, ENT doctors. Assessment involves a detailed case history, perceptual voice evaluation, and instrumental analysis of vocal function. Treatment strategies include vocal hygiene education, voice therapy techniques to improve vocal fold vibration and reduce vocal strain, and counseling. The goal is to restore the healthiest and most functional voice possible. Swallowing disorders. Dysphagia. Dysphagia refers to difficulty or discomfort in swallowing, a condition that can lead to serious health consequences, such as aspiration pneumonia, malnutrition, and dehydration. It can occur at any stage of the swallowing process: oral, difficulty chewing or moving food in the mouth; pharyngeal, difficulty initiating the swallow or protecting the airway; or esophageal, difficulty with food passing through the esophagus. Causes are diverse, including neurological conditions, e.g. stroke, Parkinson's, dementia, head and neck cancer, structural abnormalities, and aging. Speech-language pathologists are primary specialists in diagnosing and treating dysphagia. Assessment involves clinical bedside evaluations and instrumental assessments like modified barium swallow studies, MBSS, or fiber optic endoscopic evaluation of swallowing, FEES. Intervention focuses on compensatory strategies, e.g. diet modifications, postural adjustments, rehabilitative exercises to strengthen swallowing muscles, and patient education. The ultimate goal is to ensure safe and efficient swallowing, improving quality of life and preventing complications. Motor speech disorders. Dysarthria and apraxia. Motor speech disorders result from neurological impairments that affect the planning, programming, or execution of speech movements. Dysarthria is a group of speech disorders caused by muscle weakness, paralysis, or incoordination, leading to difficulties with respiration, phonation, resonance, articulation, or prosody. The characteristics of dysarthria that vary depending on the site of neurological damage, presenting as slurred speech, breathy voice, hypernasality, or abnormal speech rate. Apraxia of speech, AOS, on the other hand, is a motor planning disorder where the brain has difficulty coordinating the muscle movements needed to say sounds, syllables, and words, despite intact muscle strength. Individuals with AOS often exhibit inconsistent errors, groping for words, and difficulty initiating speech. Both dysarthria and apraxia significantly impact speech intelligibility and naturalness. Speech therapy for these conditions involves detailed assessment to identify specific deficits and targeted interventions, including articulatory drills, pacing strategies, and compensatory techniques. The aim is to improve speech clarity and functional communication. Augmentative and Alternative Communication, AAC. Augmentative and Alternative Communication, AAC, refers to methods used to supplement or replace speech for individuals with severe communication impairments. AAC systems can be unaided, relying on the individual's body, for example, gestures, sign language, facial expressions, or aided, involving external tools. Aided AAC ranges from low-tech options like picture boards and communication books to high-tech devices such as speech-generating devices, SGDs, with synthesized speech. AAC is vital for individuals with conditions like cerebral palsy, autism spectrum disorder, ALS, or severe aphasia, enabling them to express their thoughts, needs, and desires. Speech-language pathologists play a crucial role in assessing an individual's communication needs, selecting appropriate AAC systems, and providing training to both the user and their communication partners. The goal of AAC is to maximize functional communication and promote participation in daily life, ensuring individuals have a voice. Effective AAC implementation requires ongoing support and adaptation to the user's evolving needs and environments. Assessment principles in speech therapy. Effective assessment is the cornerstone of speech therapy, guiding diagnosis and intervention planning. Key principles include a comprehensive approach, considering all aspects of communication and swallowing, and an individualized approach, tailoring assessment methods to the client's unique needs and cultural background. Assessments typically involve a combination of formal and informal methods. Formal assessments utilize standardized tests with established psychometric properties to compare an individual's performance to normative data. Informal assessments include clinical observations, interviews with the client and family, and analysis of spontaneous communication samples. It is crucial to gather information across various contexts to obtain a holistic view of the client's abilities and challenges. The assessment process is dynamic and ongoing, with re-evaluations conducted to monitor progress and adjust treatment plans. Ethical considerations, such as informed consent and confidentiality, are paramount throughout the assessment process. A thorough assessment ensures that interventions are evidence-based and client-centered. Diagnostic tools and procedures. Speech-language pathologists utilize a variety of diagnostic tools and procedures to accurately identify communication and swallowing disorders. Standardized tests are frequently employed to assess specific areas such as articulation, language comprehension, expressive language, and fluency. These tests provide quantitative data that can be compared to age-matched peers. Beyond formal testing, informal procedures are equally important. Clinical observations of spontaneous speech and interaction provide valuable qualitative data. Case history interviews with clients and their families gather crucial background information, developmental milestones, and concerns. For swallowing disorders, instrumental assessments like the Modified Barium Swallow Study, MBSS, also known as a video fluoroscopic swallow study, and fiber optic endoscopic evaluation of swallowing, FEES, are used to visualize the swallowing mechanism in real time. Acoustic analysis software can objectively measure vocal parameters. These diverse tools enable SLPs to form comprehensive diagnoses and develop targeted intervention plans. The selection of tools depends on the suspected disorder and the client's age and abilities. Intervention strategies for children. Intervention strategies for children with communication disorders are diverse and tailored to their developmental stage and specific needs. For speech-sound disorders, approaches often include articulation therapy, focusing on correct placement of articulators, and phonological therapy, targeting error patterns. Language therapy for young children frequently utilizes play-based activities to stimulate vocabulary growth. Sentence structure development and pragmatic skills. For children with autism spectrum disorder, social communication interventions focus on improving reciprocal interaction, joint attention, and understanding nonverbal cues. Augmentative and alternative communication (AAC) systems are introduced when verbal speech is insufficient. Parent and caregiver involvement is crucial, as they are key partners in carrying over therapy goals into daily routines. Therapy sessions are often structured to be engaging and motivating, incorporating games and interactive materials. The ultimate goal is to foster functional communication skills that enable children to participate fully in their home, school, and community environments. Intervention strategies for adults. Intervention strategies for adults with communication and swallowing disorders are highly individualized, considering the acquired nature of many conditions and the client's life circumstances. For aphasia, therapy may involve restorative approaches to relearn language functions, compensatory strategies to use alternative communication methods, and functional approaches to improve communication in daily activities. Techniques like constraint-induced language therapy, SILT, or melodic intonation therapy, MIT, may be employed. For motor speech disorders like dysarthria, interventions focus on improving breath support, articulatory precision, and speech rate, often using pacing boards or biofeedback. Dysphagia management involves a combination of compensatory strategies, such as diet modifications and postural adjustments, and rehabilitative exercises to strengthen swallowing muscles. Cognitive communication therapy targets attention, memory, problem-solving, and executive functions. Group therapy settings are often beneficial for adults, providing opportunities for social interaction and peer support. The overarching goal is to maximize functional communication and safe swallowing, enabling adults to regain independence and participate meaningfully in their lives. Family involvement and education are critical components of successful adult rehabilitation. Therapeutic techniques for articulation. Therapeutic techniques for articulation disorders focus on helping individuals produce specific speech sounds correctly. The traditional articulation approach, often called the motor kinesthetic approach, involves a hierarchical progression from isolation to syllables, words, phrases, sentences, and conversational speech. Techniques include auditory discrimination, where the client learns to distinguish between correct and incorrect productions, and phonetic placement, where the SLP physically demonstrates or guides the client's articulators. Shaping involves gradually modifying an existing sound to approximate the target sound. Minimal pairs therapy, a phonological approach, uses pairs of words that differ by only one sound, example pat versus bat, to highlight the communicative impact of sound errors. Visual feedback, such as mirrors or biofeedback devices, can also be employed to help clients see or feel their articulatory movements. Consistent practice and generalization of newly learned sounds into everyday speech are crucial for successful outcomes. The choice of technique depends on the nature of the articulation error and the client's age and learning style. Therapeutic techniques for fluency. Therapeutic techniques for fluency disorders, particularly stuttering, aim to help individuals speak more smoothly and manage their disfluencies. Two primary approaches are fluency shaping and stuttering modification. Fluency shaping techniques focus on teaching a new way of speaking that promotes fluency, often involving strategies like easy onset of phonation, light articulatory contact, continuous phonation, and reduced speech rate. The goal is to eliminate stuttering by establishing fluent speech patterns. Stuttering modification techniques, on the other hand, focus on reducing the tension and struggle associated with stuttering moments. This involves teaching strategies like cancellations, pausing after a stuttered word and re-saying it more fluently, pull-outs, modifying a stuttered word during the block, and preparatory sets, anticipating a stutter and initiating the word more easily. Counseling is an integral part of both approaches, addressing the emotional and psychological impact of stuttering. Group therapy can also provide a supported environment for practicing new skills and reducing feelings of isolation. The choice of technique depends on the individual's age, severity of stuttering, and personal goals. Therapeutic techniques for voice disorders aim to restore optimal vocal function, improve vocal quality, and reduce vocal effort. Vocal hygiene education is a foundational component, teaching clients about behaviors that can harm or help their voice, such as hydration, avoiding yelling, and managing reflux. Direct voice therapy techniques target specific aspects of vocal production. Resonant voice therapy focuses on producing voice with optimal vocal fold vibration and minimal effort, often involving exercises that produce a humming or buzzing sensation. Laryngeal massage can help reduce muscle tension in the neck and throat. Confidential voice is a temporary technique used post-surgery or injury to promote gentle vocal fold approximation. Respiratory retraining helps improve breath support for speech. Biofeedback, using visual displays of vocal parameters, can provide immediate feedback to clients on their vocal production. The choice of technique is highly individualized, based on the specific voice disorder, its etiology, and client's vocal demands. Collaboration with an otolaryngologist is often essential for comprehensive management. Therapeutic techniques for dysphagia. Therapeutic techniques for dysphagia focus on improving swallowing safety and efficiency. These techniques can be broadly categorized into compensatory strategies and rehabilitative exercises. Compensatory strategies are immediate adjustments made during eating or drinking to reduce symptoms, such as altering food textures, e.g. pureed, thickened liquids, modifying posture, e.g. chin tuck, head turn, or reducing mealtime distractions. These strategies do not change the physiology of the swallow, but make it safer. Rehabilitative exercises aim to improve the strength, range of motion, and coordination of swallowing muscles. Examples include the shaker exercise for suprahyoid muscle strengthening, the Masako maneuver for tongue-based retraction, and various oral motor exercises. Electrical stimulation or biofeedback may also be used to facilitate muscle activation. Patient and caregiver education is paramount, ensuring understanding of safe swallowing practices and adherence to prescribed strategies. The selection of techniques is guided by instrumental assessments, MBSS, fees, and tailored to the specific deficits identified. The goal is to restore normal swallowing function as much as possible, or to establish the safest and most efficient alternative. Working with special populations, speech-language pathologists frequently work with diverse special populations, each presenting unique communication and swallowing needs. This includes individuals with developmental disabilities such as Down syndrome, cerebral palsy, and intellectual disabilities, where interventions focus on fostering functional communication and supporting cognitive development. Children and adults with autism spectrum disorder require specialized approaches to social communication, pragmatic skills, and often AAC implementation. Individuals with neurological conditions like Parkinson's disease, multiple sclerosis, or ALS often experience progressive motor speech and swallowing difficulties, requiring ongoing management and compensatory strategies. Those who have experienced traumatic brain injury, TBI, may present with a range of cognitive communication deficits, including attention, memory, and executive function impairments. Working with these populations demands a deep understanding of their specific conditions, a highly individualized approach to assessment and intervention, and a commitment to interdisciplinary collaboration. Cultural competence and sensitivity are also paramount to providing effective and respectful care. The goal is always to maximize their participation and quality of life. Ethics and professional practice are foundational pillars of speech-language pathology, guiding all clinical decisions and interactions. SLPs adhere to a strict code of ethics, which typically includes principles such as beneficence, acting in the best interest of the client, non-maleficence, doing no harm, autonomy, respecting client choices, and justice, fair and equitable treatment. Maintaining client confidentiality is paramount, safeguarding sensitive personal and medical information. Professional competence requires SLPs to practice within their scope of expertise, engage in continuous learning, and utilize evidence-based practices. Interprofessional collaboration, working effectively with other healthcare professionals, is also a key ethical responsibility. SLPs must also be aware of and adhere to legal and regulatory requirements governing their practice. Ethical dilemmas are common in clinical practice, requiring careful consideration and adherence to professional guidelines. Upholding these ethical standards ensures high-quality, client-centered care and maintains the integrity of the profession. Interdisciplinary collaboration is essential in speech therapy, as communication and swallowing disorders often coexist with other medical, developmental, or psychological conditions. SLPs frequently work as part of a larger healthcare team, collaborating with professionals such as physicians, neurologists, ENTs, pediatricians, occupational therapists, physical therapists, psychologists, social workers, educators, and audiologists. This collaborative approach ensures comprehensive and holistic care for the client. Effective collaboration involves clear communication, shared goal setting, mutual respect for each profession's expertise, and coordinated treatment planning. For example, an SLP working with a stroke patient might collaborate with a neurologist for medical management, a physical therapist for mobility, and an occupational therapist for daily living skills, all while addressing communication and swallowing needs. This integrated approach optimizes client outcomes by addressing all aspects of their well-being. It also prevents fragmented care and ensures that interventions are consistent and complementary. Interdisciplinary teamwork is a hallmark of modern healthcare practice. Documentation and report writing. Thorough and accurate documentation is a critical professional responsibility for speech-language pathologists. Clinical documentation serves multiple purposes. It tracks client progress, justifies services to insurance providers, facilitates communication among healthcare team members, and provides a legal record of care. Key components of documentation include initial evaluation reports, treatment plans, goals, objectives, procedures, daily progress notes, and discharge summaries. Reports must be clear, concise, objective, and adhere to professional and legal standards. They should accurately reflect the client's current status, the services provided, and the client's response to intervention. Using standardized terminology and avoiding jargon ensures clarity and consistency. Electronic health records, EHRs, are widely used, requiring proficiency in digital documentation systems. Effective report writing skills are essential for advocating for clients, securing funding for services, and demonstrating accountability. Training in documentation principles and practices is an integral part of speech therapy education. Poor documentation can lead to denial of services, legal issues, and compromised client care. Research and evidence-based practice. Research and evidence-based practice, EBP, are fundamental to the advancement and effectiveness of speech therapy. EBP involves integrating the best available research evidence with clinical expertise and client values and preferences. This means SLPs must stay current with scientific literature, critically evaluate research studies, and apply findings to their clinical decision-making. Research in speech therapy spans various areas, including the efficacy of interventions, the development of new diagnostic tools, and the understanding of underlying mechanisms of communication and swallowing disorders. SLPs engage in lifelong learning, attending conferences, reading journals, and participating in continuing education to ensure their practice is informed by the latest evidence. Contributing to research, whether through direct involvement or data collection, also helps to build the evidence base for the profession. By adhering to EBP principles, SLPs ensure that their interventions are effective, ethical, and client-centered, ultimately leading to improved outcomes and accountability. This commitment to evidence ensures the highest standard of care. Career pathways in speech therapy. A career in speech therapy offers diverse and rewarding pathways, catering to various interests and specializations. Speech-language pathologists can work with children in school settings, addressing developmental language disorders, articulation, and fluency, or in early intervention programs. In medical settings, such as hospitals and rehabilitation centers, SLPs often work with adults and children who have acquired communication and swallowing disorders due to stroke, TBI, or neurological diseases. Private practice offers flexibility and the opportunity to specialize in specific populations or disorders. Other settings include skilled nursing facilities, outpatient clinics, and universities, where SLPs may engage in teaching and research. Specializations can include dysphagia, voice disorders, AAC, autism, or cleft palate. The profession requires a master's or doctoral degree in speech-language pathology, clinical fellowship, and state licensure, along with national certification. Continuous professional development is essential for career growth and staying current with best practices. The demand for qualified SLPs remains strong, reflecting the critical need for their services across the lifespan.